What is cystic fibrosis? Cystic fibrosis is a life-threatening, genetically inherited disorder causing damage to the lungs and digestive system. Cystic fibrosis is primarily present in the lungs, over time leading to breathing difficulty. The disease works by affecting the lungs, digestive organs, and the pancreas primarily due to a mucus buildup. The CFTR gene regulates the production of protein that controls the amount of water and salt moved in and out of body cells. If you have the defective gene, the amount of salt and water made by the cells fluctuate, causing a thick and sticky mucus. Both parents must be carriers for a child to have cystic fibrosis, and a family history of the disease is a risk factor. The disease is more highly present in the white population, particularly those of Northern European ancestry, affecting roughly 1 in 3,000 white newborns. In African Americans, the number drops to 1 in 17,000 and is even lower in Asian Americans at 1 in 31,000.
Because the protein that regulates the water and salt in cells is misfolded, the body will increase the production of salt, causing the skin to taste very salty. This will also cause the buildup of mucus in the lungs, leading to chronic infections and characterized by continuous coughing and wheezing. Problems that result from lack of digestive enzymes is poor growth and weight gain, stomach pain, low bone density, and greasy stools. Infertility occurs in most males because of an absence of the vas deferens, and rare symptoms of CF is clubbing of the fingertips and toes from low blood oxygen levels. Diagnosis can be determined as early as 10 weeks after conception. An analysis of amniotic fluid or placenta tissue can determine if a fetus has cystic fibrosis. After showing signs, people can get chest x-rays, perform lung function tests, or test the bacteria in the lungs to gauge the severity of the disease. No cure is currently known for CF. The main goal for CF patients is to reduce the rate of lung destruction and compensate for digestive problems. Most CF patients will be on multiple antibiotics, oral or inhaled, to fight infections. Mucus can be shaken off through chest oscillations, most easily done via an inflatable vest. Common inhalants include pulmazine, sodium chloride, and steroids to increase the lung function. The precautions to take to avoid increasing the severity of CF or contracting other related diseases include limitation of germ exposure, maintaining a healthy diet, avoid smoking, remain active, and undergo physical therapy. Some conditions associated with CF include a higher risk of contracting lung infections due to an increase in bacterial production, poor growth, and malnutrition because of the inability to properly absorb the food and nutrients by the pancreas, liver disease, which is caused by the mucus blocking the bile duct, infertility in males as sperm is unable to join with the semen due to CBAVD. The average survival rate for those with CF is anywhere from the mid to late 30s. However, the median for CF is 40 years of age, compared to the 1950s, where those diagnosed rarely made it to primary school. As time goes on, CF worsens, increasing the probability of contracting pancreatitis, liver disease, and gallstones. Individuals will also be at risk of contracting cystic fibrosis-related diabetes, which is similar to type 1 and type 2 diabetes in that the monitoring of blood sugar levels and insulin intake is required, but the condition itself is not exact.
If you or anyone you know have signs or symptoms, contact your doctor or visit the Cystic Fibrosis Foundation online.